It really depends on what we're implementing. It could be something as simple as we're just giving them a tip sheet and they go off and they're happy and they're doing their thing. Or it could be something that requires tip sheets and education in advance for weeks.
Thank you for joining this episode of the Elephant in Your Hospital podcast with Futura Healthcare. I'm Jessica Ballash, Director of Marketing at Futura, and today I'm joined by industry healthcare leaders Valere Lemon, Division Director of Clinical Informatics, and Wesley Jayroe, Director of Enterprise Applications, as well as Cyndi Cahill, who has over 30 years healthcare experience wearing multiple hats, including former CIO and former CHIME board member. In today's episode, we discuss the top challenges associated with new software technology being implemented and managing the end user experience and their expectations. As far as implementing new software technology within your organizations and both the maybe challenges around implementing them and then also managing your end users experience and expectations with that, what typically when you are implementing a new software, what is your process to train your teams on those? Val, if you'd like to start.
Sure. We have a multidisciplinary process. We do a combination of doing web-related training, like computer-based trainings, where they're kind of going through a module and learning the basics. We do a lot of hands-on training also. Our informatics team, when we have new technology going live, we will round on the units. Myself and our other division leader, we will be on site at the hospitals also to provide support. So really it's that constant FaceTime. So obviously we're going to be a lot more present in the very beginning of technology implementation. And then we provide an escalation pathway so that if there's issues or concerns, they have a means to get to us and know how to escalate those issues. But then we do daily rounding always on our unit so that we can get feedback. And so it's, it kind of starts off heavy and really in the weeds of looking at what do we need to do, providing tip sheets, talking to end users, watching them, shadowing them, seeing how they're actually using it. So it really depends on what we're implementing. It could be something as simple as we're just giving them a tip sheet and they go off and they're happy and they're doing their thing. Or it could be something that requires tip sheets and education in advance for weeks, and where we're coming and we're talking about it and we're showing demos, and then we're actually there on site when it goes live, and then following up afterwards. So it really depends, and I think we're pretty good about taking the feedback on, hey, this went live and we felt like we weren't prepared, and then figuring out how to regroup the next time. But I think we tend to try to over-educate, even though, because it never fails, people will say, I didn't know there was an EHR release today happening, and there will be a sign right on the nurse's station right in front of them, and you're like, you didn't? Really? So, everybody's just so busy and they're focused on actually doing patient care, and that's great. So it's really just repetition.
Okay.
Yeah, I would say, yeah, we have a learning institute, and then actually our clinical informatics team just is standing up a training arm that they can actually do some of their own specific targeted training. But I'll agree with Val, it really depends on the application. So in some of the HR applications that people are engaged with, we have in-application training where they can go in and do it. But for clinical training and EHR related training, when we onboard them, there is a pretty stringent process that we follow of training that they have to take before they can actually receive certain access within the EHR, so that we can guarantee that they have a base level of knowledge before they actually start using the system, regardless of their experience before they join the organization. But yeah, I guess that's all I've had on that.
Yeah, I just wanted to add, I forgot to mention that we partner with our education department as well. So they also are rounding and doing education. So they're getting it from all facets, but I didn't want to leave that important part out because they're great partners too.
Yeah, and I wanted to mention we also have a program for EHR upgrades because we know how impactful those are. It affects everyone at the bedside, and they're massive. They come with a lot of new functionality. And so
Yeah.
leading up to, we start preparing those. We go through the actual release notes and determine what changes are going to require what level of training. And then they have elbow support there during the week. It's a they're called Spocks, and they're on the elbow and actually help train them, during the week, but after go live. So.
Got it. Are those your own internal resources that do that, or do you bring in support for that? The
Internal
elbow?
resources. That's our
Okay.
clinical informatics team provides
Okay.
that. Well, actually, they do the training to the people, but it's actually nurses that have volunteered to do that. So they require a higher level of training prior to the upgrade.
Got it. Okay. So we know that technology innovations never end in healthcare. And I know we talked about this a little bit in our previous conversation. So when decisions are made outside of your departments to implement new technology or software, without, your involvement in those decisions, what impact does that have on your departments? And then how do you go about getting buy-in for your teams? Wes, if you'd like to start there.
Yeah, I would say that's what we're trying to prevent. Because a lot of times when technology is brought in without the correct review, we run into issues when we try to execute on a project. I don't know about y'all, but software sales people will tell you that it can do it all. But when you start to get into the details of the implementation, it doesn't always perform like you're expecting it to.
Mm-hmm.
So that's our goal, is to catch those things early on and really see if we already have something that could, meet the need without having to purchase a new software and then support it and upgrade it and all of those types of things. So that's one of the things we're trying to do now, is prevent that from happening.
Val, I can't imagine in a large organization like you work in that it's you're able to keep your hands around everything that is being installed. It must come at you from all sides.
Yeah.
I don't know what you're talking about. I always know everything that's coming, always with tons of lead time, never a last minute implementation that we didn't know about. That never happens. I feel like our corporate team does a pretty good job of telling us in advance, but sometimes when you have specialty departments that they're working with, they're focused on that department. That department might not think about including us in that. So, for example, they might be working with pharmacy on a project, and they didn't think to talk to us about an implementation that impacts more than pharmacy end users. So we have calls with our corporate informatics team regularly so that we're up to date and know what's coming down the pipeline. We also stay in touch with our other division leaders so that we kind of know what they're piloting and what they have going live, because of our large organization, we have that lead time a little bit, because we can see, oh, they're implementing it. So at some point it's probably coming to us. We don't know when, but we can kind of be prepared. But yes, we inevitably have times where we're getting things that are coming to us that we're told to implement, and we might not necessarily think that we need it or that our process was broken, but nonetheless, we have to do our jobs. And it's really just trying to explain the why to our end users. That is the biggest thing. Is I know this is frustrating. I know it's a change to your workflow, but here's why our corporate team thought this was important, or why us as a division leadership team thought this was important to you, even providing safety examples, or how this is saving them time. And sometimes it doesn't matter. You're still going to frustrate people, and they don't care, because it's disruptive, and technology, as great as it is very disruptive. And when doctors and nurses and ancillary staff are trying to just take care of their patients. They don't want one more thing that they have to click on or look at. They just want to do their jobs. And I understand that because I'm a nurse and I don't, I'm the one telling people it's okay. Here's one more gadget for you to look at today for your sepsis workflow. But it's, it's really just kind of getting down to their level and listening. I think that's been the biggest help for us is when we're implementing it, listening to the feedback of the people that we're giving it to and hearing their pain. And if it really is a problem, taking it back to the corporate team and saying, hey, I'm sorry, this really just isn't working for us. And if it's a no, we have to do it regardless, great. But if not, can we provide feedback or can we make some changes based on those learnings? And, I always try to assume positive intent. But I know that the farther you get away from bedside care, it's hard to really appreciate how you're impacting the clinicians at the bedside. So if we do have the ability to make decisions as a division team or at a facility level, we always include end users that will be using it in advance so that they have the ability to voice their opinion and say, no, this won't work for XYZ reason. So we're kind of getting ahead of the curve and trying to, hopefully cut off any major issues at the pass.
Yeah, I was going to say, sometimes we are salesmen, right? We have to help them understand why what we're providing is going to help them or help the enterprise as a whole. Because that's really what it's about is we've got to, it's collecting data and, finding insights in that. But at the same time, they have a seat at the table with us. The people that are going to use the technology, they're usually coming to us and say, we have a problem. And we're saying, let's partner to come up with the best solution for you. Because we know that when a provider's experience is improved, then the patient experience is improved. And that's what we're going after.
Great point.
Yep, definitely. We may have already covered this a little bit, but if there was anything else that you wanted to add specific to what governance processes are in place within your organizations around implementing new technology and software or making any changes to better support your workflows. Do you have anything to add around that, Val?
It's not necessarily related to new technologies. I mean, we do have a governance where if an end user wants a new app added to their iPhone, to their iMobile devices, or they are looking for a change to their workflow, they escalate that to their director of clinical informatics at the facility level. Then that, if there's a cost associated, obviously it has to go through division, sometimes corporate approval processes. So that's one side. We have an actual governance document that we've created at the division side so that our DCIs and also our ITG group know that if somebody's asking for a change to an order set, they can go and look at our list of our governance documents and say, okay, these are off limits. These are not off limits. I can go ahead and make these changes, or these ones need somebody else's oversight. And usually that's things like sepsis, stroke, anything regulatory related. Because we try to standardize all of those. But we try to not tell everybody everything that they can do, but also, keeping things in boundaries. But, that's our typical governance, just related to really anything is, looking at what's the impact, how many end users is it impacting, do we need it? If it's a good idea at one facility, is a good idea at all 11 of our facilities? So we meet as a team every 2 weeks also to talk about any requests that have come up so that we're thinking about how we can help everybody. If a problem has come up, it's probably come up other places too.
Okay. Wes, did you have anything else to add there?
Yeah, I was going to say our governance groups are having to change as we grow because we're doing a lot of growth right now. And so there was in some cases where, an order set change would have to go through 3 or 4 different committees. And so our clinical informatics group is doing a lot of work to say, okay, what change requires what leadership sign off and establishing so they can go through one committee and we can get changes done a lot faster than what we're doing now. It's a top priority.
Okay. Well, we're coming up on time here, so if there's nothing else that either of you wanted to add, I wanted to thank you both for taking the time to spend with us and share your experiences. You both are doing great work for your organization, so I appreciate it. And we look forward to future conversations with you, but definitely appreciate your time.
Thank you so much, Cyndi.
Thank you.
And
All right. Thank you all. Thank you for listening to today's episode. Be sure to subscribe to listen to future episodes of the Elephant in Your Hospital podcast, or visit our website at futuraworks.com/podcast.